So today we had a female patient with right-sided knee pain, no range of motion limitations, that came in wanting an evaluation. So we decided to get right to it with some functional evaluations using ViFive. She had some pain increase with that squat. I saw some valgus going on in her right side and a little weight shift to the left. So we wanted to look into this a little bit deeper using the ViFive Analyze feature. First thing we decided to do was use trace of that right knee, see how far outside of that vertical line she's going. First squat looks a little good. When we see she has that pain right there, she starts to valgus in a little bit. And what really is interesting is I noticed, okay, valgus isn't so bad here, even though we can, quantify this with this application and kind of see how far she's moving out. But what I'm really noticing is she doesn't want to put weight through that knee. So what we want to do is draw a vertical plumb line through the pelvis, and we can see here that she is significantly leaning towards that left side, up to 19 to 20 degrees in certain instances. So when we look at that chart, we can see whenever she's engaged, she's heavily relying on that left side, which is giving us some really good data and input that we can use over time and give her for educational purposes to show she's better if she starts putting more weight and has less pain on that right side. Here we're going to look at a single leg squat because that's another good assessment. What I'm seeing is how much excursion or how much wobbliness she has. Again, pretty significant here, so I want to add that trace feature to that right knee to see how far outside of normal and outside of the hip she's going. Again, not even necessarily valgus, but just very, very unstable. So what we're looking at here is a quantification of how unstable she is. Again, I like this feature of using that vertical plumb line because I want to see if she's still favoring that opposite side. Not necessarily too much here, but again, something good to continue to look at. As we continue to look at the right side and we want to see, again, is this more stable? Comparing it to the left, looks a little bit more stable and a lot less wobbly. So we can kind of use that for educational purposes as well. Again, here loading on the right side, much less excursion overall. So that's what we're comparing to as well. Maybe it's bad, maybe it's not, but again, we have that information to utilize. Here we're going to utilize a box jump. Now here we see a huge swing in valgus, which is really important and great for education, and you can just see she doesn't want to jump on that right leg. So again, this is plenty of assessment and plenty of information, but this is kind of valuable quantitative information we can use utilizing the free motion feature on the application. With her box jump. Again, if we did a vertical plumb line, we would see that she is shifting far over to the left, avoiding that right side as much as possible. And here we go with that vertical plumb line coming down, and we can see as that impact occurs, you can see a very high peak in that range of motion or lateral bend, so over 22 degrees off of midline because of that association with the valgus and not putting stress through that right knee. So really good example. And again, I saw some Trendelenburg, which was really important because of maybe potentially weakness on that right hip. Again, you can see pretty significant hip drop right there during the gait assessment. We are also able to utilize a horizontal plumb line from right to left hip to see how much hip drop or how far outside of neutral pelvis she has during her gait assessment, again, associated with that Trendelenburg. And after treatment and assessment for a few weeks, we should see objective improvements in all of those areas measured and giving that great feedback to the patient to create a happy client.